a lot about right now, as long as the data holds, are miracles. If Pfizer and Moderna stay in the data above 90% effectiveness, then it's incredible news. And we can put this entire pandemic in the past. So the good news today, because we heard about Pfizer before, is Moderna got more of their data than the initial. It's still at least 94% effective, but here was the other piece. At least in this trial, it was 100% effective on severe cases. And that's what we want, 100% effective on severe cases. I watched a national expert talk about the fact that if this holds, we can turn COVID into something like a cold or a minor flu. Think about that. After all that we have been through, and after all that we have lost, and all of the people that we are going to miss, we have a chance to beat this thing and to render it into something can't harm anybody else ever again. We can take on this adversary and forever defeat it if we do this right and get back to everything that we have missed during these very difficult numbers of months. So that's a great news for today. It was great news to wake up to, and it's very exciting. So all that effectiveness and the rest leads us to the win. We believe that we are going to get our first allocation of Pfizer vaccines as early as mid-December. This will all depend on when it gets initial approval and then the shipping occurs. We believe that we could get the first allocation of the Moderna vaccine as early as 2 weeks after when we get the Pfizer vaccines. Now, initially, these shipments are going to be very limited, but they are still very exciting. And the numbers we're getting are a lot smaller than what initially the federal government thought they could provide, but it's still important. So today we can announce that we will receive in our first shipment of Pfizer vaccine 38,025 doses. That's 38025 doses. So, and those will be provided to 38,025 different individuals. We can go ahead and provide everybody the first of these shots, and then we will receive the boosters, because the Pfizer vaccine and Moderna, like that hepatitis vaccine that we had to take the two separate shots separated by about 3 weeks. Dr. Steck can correct me when he comes on right after me. So we are locking in our plan this week to provide to the federal government, and we will be ready on moment one that we're able to start providing these vaccines. So for this limited amount, our plan is going to involve two groups that will receive certain portions of the first allocation of the Pfizer vaccine. First group is long-term care residents and staff. Long-term care residents make up almost 66% of the deaths due to COVID. Think about that. If we can get through and vaccinate our residents and our staff, we could cut off 66% of the deaths that we are seeing right now. So our numbers can dramatically change, and we can provide such better protection to these individuals. And long-term care residents, when they have to go to the hospital, take up more resources than the average patient. So when we look at numbers of doctors and nurses that are available and how many patients they can see, if we can protect our long-term care residents, they don't end up being hospitalized, we have more capacity there in those facilities. So we believe that there are about 50,300 residents and staff in the highest and kind of the most intensive tier of long-term care. So in this first allocation, we'll be providing 26,000 doses to those long-term care residents and staff. Provided that they can handle the Pfizer vaccine, Walgreens and CVS would handle this program as they've contracted to with the federal government. Our goal is to quickly vaccinate the most vulnerable parts of our population. Second group that will receive part of this initial allocation are our frontline COVID healthcare workers. This program, as opposed to the Walgreens CVS, is a state-run program that goes through healthcare facilities that meet certain requirements and have been able to sign up through the state with the federal government to provide vaccinations. These facilities will receive 12,000 doses. We are finalizing a list of what facilities will receive them, but they will be all over the state. Geographically, we're committed to sites in Northern Kentucky, Eastern Kentucky, Western Kentucky, South Central Kentucky, along with Louisville and Lexington. And our final location list will be provided to the federal government at least by Friday. So I discussed this plan with several hospital CEOs today, and I just want to reiterate that they agree that this plan and the way that we are setting these two priorities help them in their ability to serve patients by reducing long-term care residents that would need hospitalization, that need more time from a doctor or a nurse, and therefore free up more time for those individuals to help other people, as well as the fact that they unfortunately are the least likely to make it out of the hospital when they have to go there. Now, we are projected to get 76,700 Moderna vaccinations in our first shipment, which again, we hope is in late December. But we are going to be ready. We believe the federal government is going to agree to this plan. And I think it's going to be their recommendation as well. But part of being ready is also the practice run that we have been doing today. So we've already been working with the U.S. Centers for Disease Control and Prevention on our plans to distribute a corona vaccine or vaccines in the Commonwealth. So right now, this week, we're participating in an end-to-end exercise with the CDC along with Pfizer and McKesson. This will test one shipment of an empty thermal shipping container from Pfizer and a mock ancillary kit from McKesson to one clinic site, in this case, the University of Kentucky Medical Center. As part of this exercise, the Kentucky Immunization Branch has until noon today to place an order for UK Hospital in what's called VTRAX, which is the CDC's ordering program. Tomorrow, CDC's VTRAX will send the test order to Pfizer and McKesson. The empty thermal shipper and mock kit will be shipped by the respective companies. By Tuesday, the shipment tracking numbers should be visible in the system. The empty container and mock kit are expected to arrive at UK Hospital as early as Wednesday or as late as Friday. This is a test. This is only a test, but it's a test to make sure that the logistical part of us getting vaccines from the federal government upon ordering them is going to work and work smoothly. So Kentuckians should feel confident that we are working day in and day out to make sure that we can get this out as quickly as possible. And along the way, we'll talk to you about some of the difficulties. Information, even from the federal government, seems to change by the day, but this is the problem that I so desperately wanted to have. Even if that problem is a lot less vaccine early than expected, it's still coming. It is still coming. The light at the end of the tunnel is getting brighter and brighter. It's also why I need you to keep fighting. Because if there are folks in long-term care that we get vaccinated starting this month, maybe we could vaccinate most all of long-term care by the end of January if shipments come in. But we don't do our part between now and then. There are a number of people in those facilities that'll never get to see that vaccine or get the benefit of it. More than ever, what we do right now can save lives, especially of the most vulnerable.